ಹಲೋ, ಮುಂದೆ ಬರಬೇಕೆಲ್ಲರೂ. Please, it's time up. Today we have a very important program, that is a diabetic awareness program. ಡಯಾಬಿಟಿಕ್ಗೆ ಅವೇರ್ನೆಸ್ ಯಾತಕ್ಕೆ ಬೇಕು ಅನ್ನೋದು ನಿಮಗೆ ಪ್ರಶ್ನೆಯಾಗಿ ಕಾಣ್ಬೋದು. ನಾವೆಲ್ಲ ತುಂಬ ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿದ್ದೀವಿ, ನಮಗೇನು ಆಗೋಲ್ಲ ಅಂತ. ಆ ಕಾಲ ಮುಗಿದೋಯ್ತು ಆಯಿತಾ. ಈಗ ಹಿಂದಿನ ಕಾಲದಲ್ಲಿ ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲಿ ಭಯ ಇರಲಿಲ್ಲ. ಬಿಕಾಸ್ ಹಿಂದಿನ ಕಾಲದಲ್ಲಿ ದ ಲೈಫ್ ಸ್ಟೈಲ್ ವಾಸ್ ಮೆಕ್ಯಾನಿಕಲ್. ಹೌದಾ, ಲೈಫ್ ಸ್ಟೈಲ್ ವಾಸ್ ಮೆಕ್ಯಾನಿಕಲ್. ಐ ಮೀನ್ ಟಿಲ್ 1970s, if I am not wrong, more than 85% of the population involved in agriculture. Once you are involved in agriculture with your own hands, you are sure of you are away from diabetes, because that takes care of. You are close to nature, you do a lot of work, and so that in a younger age you won't get diabetes. But at present, from birth, you are leading a kind of luxury life. A kind of luxury ಅಂದರೆ ದುಡ್ಡು ಜಾಸ್ತಿ ಇದ್ದರೆ ಮಾತ್ರ ಲಕ್ಸುರಿ ಅಂತ ಅಲ್ಲ. ಈಗ ನಾವು ಜಾಸ್ತಿ ಮೈಕೈನ ಬಳಸಬೇಕಾಗಿಲ್ಲ. ಏನಕ್ಕೆ? ಹಿಂದೆ ಆಹಾರ ಪಡ್ಕೊಳ್ಳೋಕ್ಕೆ ನಾವು ಕಷ್ಟಪಡಬೇಕಾಗಿತ್ತು, ನಮ್ಮ ಮನೆಗಳನ್ನು ನೋಡ್ಕೊಳ್ಳೋಕ್ಕೆ ನಾವು ಕಷ್ಟಪಡಬೇಕಾಗಿತ್ತು. ಎಲ್ಲರ ಮನೆಯಲ್ಲೂ ಬಟ್ಟೆ ಕಲ್ಲಿತ್ತು, ಜ್ಞಾಪಕ ಇದೆಯಾ? ಅಮ್ಮಂದಿರು ಮಧ್ಯಾಹ್ನದ ಹೊತ್ತಾದ್ರೆ ಸೋಪಿನ ನೀರಲ್ಲಿ ನೆನಾಕ್ಬಿಟ್ಟು ಬಟ್ಟೆ ಒಗಿತಾ ಇದ್ರು, ಬಗ್ಗಿ ನೆಲ ಒರೆಸ್ತಾ ಇದ್ರು. ನೆಲ ಒರೆಸೋ ಕಡ್ಡಿ ಇರಲಿಲ್ಲ, ಮಿಕ್ಸರ್ ಇರಲಿಲ್ಲ. ಮಿಕ್ಸರ್ ಬಿಕೇಮ್ ಹೌಸ್ ಹೋಲ್ಡ್ ಆಫ್ಟರ್ 75 or 80. Till 1970s and 80s, ಮಿಕ್ಸರ್ ಇರಲಿಲ್ಲ. ದೋಸೆ ಮಾಡಬೇಕು ಅಂದರೆ ಒಳಕಲ್ಲಲ್ಲಿ ರುಬ್ಬಬೇಕಾಗಿತ್ತು. ಓಕೆ, ಸೊ ವಿತ್ ದಿಸ್ ಕೈಂಡ್ ಆಫ್ ಲೈಫ್ ಸ್ಟೈಲ್ ಇನ್ ದ ಅರ್ಲಿಯರ್ ಡೇಸ್, ನ್ಯಾಚುರಲಿ ಇಟ್ ವಾಸ್ ಟೇಕನ್ ಕೇರ್ ಆಫ್. ಆದರೆ ಇವತ್ತೇನಾಗಿದೆ, ನಮಗೆ ಎಲ್ಲ ಅನುಕೂಲಗಳು ಇದೆ. ಯಾರ ಮನೆಯಲ್ಲೂ ಮಿಕ್ಸರ್ ಇಲ್ಲದೆ ಇರೋ ಮನೆಯಲ್ಲಿಲ್ಲ. ಈವನ್ ಇನ್ ಸ್ಲಮ್ ನೀವೆಲ್ಲೋದ್ರೂ ಮಿಕ್ಸರ್ ಇರುತ್ತೆ, ಎಲ್ಲೋದ್ರೂ ಟಿ ವಿ ಇರುತ್ತೆ, ಎಲ್ಲೋದ್ರೂ ವಾಷಿಂಗ್ ಮಿಷಿನ್ ಇರುತ್ತೆ. ವಾಷಿಂಗ್ ಮಿಷಿನು ಮೊದಲಿರಲಿಲ್ಲ. ಎಲ್ಲವೂ ಸೌಕರ್ಯಗಳು ಇದ್ದಾಗ ನಮಗೆ ಹೆಚ್ಚಿನ ಸಮಯ ಸಿಗ್ತಾ ಇದೆ. ಆ ಹೆಚ್ಚಿನ ಸಮಯವನ್ನು ನಾವು ನಮ್ಮ ದೇಹಕ್ಕೆ ಅಗತ್ಯವಾದಷ್ಟು ಕೆಲಸ ಕೊಡ್ತಾ ಇಲ್ಲ. ಆಹಾರನ ನಾವೇನು ತಗೊಳ್ತಾ ಇದ್ದೀವಿ ಒಳಗಡೆ, ಆಹಾರನ ಜೀರ್ಣ ಆಗಿ ಪಚನವಾಗಿ ನಾವು ಹೇಗಿರಬೇಕೋ ಹಾಗೆ ಇರೋದಕ್ಕೆ ಮಾಡಬೇಕಾದಷ್ಟು ಕೆಲಸವನ್ನು ನಾವು ಮಾಡ್ತಿಲ್ಲ. ಈ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ಡಯಾಬಿಟಿಕ್ಸ್ ಅನ್ನೋದೇನಾಗ್ತಿದೆ, ಅಥವಾ ಮಧುಮೇಹ ಅಂತ ಕರೀತಾರೆ ಕನ್ನಡದಲ್ಲಿ, ಆ ಮಧುಮೇಹ ರೋಗ ಚಿಕ್ಕ ವಯಸ್ಸಿನವ್ರಿಗೆ ಬರ್ತಾ ಇದೆ. ಇದು ಒಂದು ಭಾಗ. ಆದರೆ ಆಹಾರ ಕ್ರಮ ಏನಿದೆ, ಹೋಟ್ಲಿಗೆ ಹೋಗೋದು ತುಂಬ ಅಪರೂಪ ಆಗಿತ್ತು. ನಾವೊಂದು ಇದರಲ್ಲಿದ್ದೀನಿ, ಒಂದು ಸ್ವಲ್ಪ ಹೊತ್ತು ಬಿಟ್ಟು ಮಾಡ್ತೀನಿ. ಹೋಟ್ಲಿಗೆ ಹೋಗೋದು ತುಂಬ ಅಪರೂಪ ಆಗಿತ್ತು. ಎಲ್ಲೋ ಅಪರೂಪಕ್ಕೊಂದ್ಸರಿ ಹೋಟ್ಲಿಗೆ ಕರ್ಕೊಂಡು ಹೋಗ್ತಾಯಿದ್ರು. ಈಗ ಹೋಟ್ಲು ರೆಗ್ಯುಲರು, ಹೋಗಲೂ ಬೇಕಾಗಿಲ್ಲ, ಕೈಯಲ್ಲಿ ಕಾರ್ಡ್ ಇದ್ದರೆ ಸಾಕು, ಉಜ್ಜಿ ತರಿಸ್ತೀರ, ಹೌದಾ? ಸೊ ಹೋಟೆಲಿನ ಆಹಾರದಲ್ಲಿ ಯು ಆರ್ ನಾಟ್ ಗ್ಯಾರಂಟಿ ಆಫ್ ಒನ್ ದ ಇಂಗ್ರೀಡಿಯೆಂಟ್ಸ್, ಸೆಕೆಂಡ್ ದ ಮೆಥಡ್ ಆಫ್ ಪ್ರಿಪ್ರೇಷನ್, ಓಕೆ, ಥರ್ಡ್ ಇಟ್ಸ್ ಕ್ವಾಲಿಟಿ. ಇವೆಲ್ಲವನ್ನೂ ನಾವು ದುಡ್ಡು ಕೊಟ್ಟು ದೇಹಕ್ಕೆ ಸೇರಿಸ್ಕೊತಾ ಇದ್ದೀವಿ. ಅದು ಇಂಡೈರೆಕ್ಟಾಗಿ ನಮ್ಮ ದೇಹದ ಮೇಲೆ ಏನೆಲ್ಲ ಪ್ರಭಾವ ಬೀರ್ತಾ ಇದೆ ಅಂದರೆ, ಬರೀ ಮಧುಮೇಹ ಅಲ್ಲ, ಹಲವು ರೋಗಗಳಿಗೆ ನಾವು ಬಹಳ ಸುಲಭವಾಗಿ ತುತ್ತಾಗ್ತಾ ಇದ್ದೀವಿ. ಸೊ ಈ ಹಿನ್ನೆಲೆಯಲ್ಲಿ ಅವರು ಡಯಾಬಿಟಿಕ್ಸ್ ಅವೇರ್ನೆಸ್ ಪ್ರೋಗ್ರಾಮ್ ಮಾಡ್ತೀನಿ ಅಂತ ಅಂದಾಗ ಐ ಫೆಲ್ಟ್ ಇಟ್ ಇಸ್ ಎ ನೆಸಸರಿ. ಯಂಗರ್ ಏಜ್ ತುಂಬ ಫುಲ್ ಜನ ಆ್ಯಕ್ಚುಲಿ ಇರಬೇಕಾಗಿತ್ತು. ಆ್ಯಕ್ಚುಲಿ ಯಂಗರ್ ಏಜಲ್ಲಿ ಇದು ತುಂಬ ಅಟ್ಯಾಕ್ ಆಗ್ತಿರೋದ್ರಿಂದ, ತುಂಬ ಚಿಕ್ಕ ವಯಸ್ಸಲ್ಲ, 25-30 ತುಂಬ ಜನಕ್ಕೆ ಬರ್ತಾ ಇದೆ. ಸೊ ಅದು ಲಾಂಗ್ ಟರ್ಮ್ ಎಫೆಕ್ಟ್ಸ್ ಆರ್ ಡಿಫ್ರೆಂಟ್. ಅಯ್ಯೋ ಮೆಡಿಸಿನ್ ಇರುತ್ತಲ್ವಾ, ಡಾಕ್ಟರ್ ಇರುತ್ತಲ್ವಾ ಅಂತಂದರೆ, ಡಾಕ್ಟ್ರು ಮೆಡಿಸನ್ನು ಒಂದು ಮಟ್ಟಕ್ಕೆ ಮಾತ್ರ ಸಹಕರಿಸಬಲ್ಲರು. ನಮ್ಮನ್ನು ನಾವೇ ಕಾಪಾಡ್ಕೋಬೇಕು. ಬಿಯಾಂಡ್ ದಟ್ ಐ ಹೋಪ್ ಐ ಆಮ್ ರೈಟ್. ಸೊ ನಾವು ವಿತ್ ದಿಸ್ ಇಂಟ್ರಡಕ್ಷನ್, Dr.HN is with us from Mohan's Diabetics Specialities Center. ಅಪ್ಪ ಜನರಲ್ ಇದನ್ನು ಹಾಕಪ್ಪ. ಅಜಿತ್ ಜನರಲ್ ಇದನ್ನು ಹಾಕಪ್ಪ, ಜನರಲ್ ಸ್ಕ್ರೀನ್ ಹಾಕು. ಮೋಹನ್ಸ್ ಡಯಾಬಿಟಿಕ್ಸ್ ಸೆಂಟ್ರಿಂದ ಬಂದಿದ್ದಾರೆ. ನಿಮ್ಗವರು ಒಂದು ಅರ್ಧ ಗಂಟೆಗಳ ಕಾಲ ಆ ಒಂದು ಡಿಸೀಸಿನ ಬಗ್ಗೆ ಅವೇರ್ನೆಸ್ ಕೊಡ್ತಾರೆ. ಅದು ನಿಮಗಷ್ಟೇ ಅಲ್ಲ, ನಿಮ್ಮ ಮನೇಲಿ ಕೂಡ ನೀವು ಎಲ್ರಿಗೂ ಹೇಳ್ಬೋದು. Dr. Ajit is practicing medicine. He is MBBS and MBBS, MD and fellowship ಮಾಡಿ ಅವರು ಈ ಒಂದು ಲೆಕ್ಚರ್ ಕೊಡೋಕ್ಕೆ ಬರ್ತಾ ಇದ್ದಾರೆ ಅಂದರೆ, there is a commitment within him without which you cannot, I can make out. For the reason, he is spending hours of time. ಇಬ್ಬರು ಪೇಷಂಟ್ ನೋಡಿದ್ರೆ ಅವ್ರಿಗೆ 2,000-3,000 ರೂಪಾಯಿ ದುಡ್ಡು ಬರ್ತಾ ಹೋಗುತ್ತೆ. ಸೊ ಅವರು ಪೇಷಂಟ್ ನೋಡೋದನ್ನು ಬಿಟ್ಬಿಟ್ಟು ಇಲ್ಲಿಗೆ ಬರಬೇಕು ಅಂತಂದರೆ, ದರ್ ಇಸ್ ಅಫ್ಕೋರ್ಸ್ ಅವ್ರ ಕ್ಲಿನಿಕ್ ಇದೆ, ಜನ ಬರಬೇಕು, ಅದೆಲ್ಲ ಒಂದು ಪಾರ್ಟು. ಎರಡನೇದು ಅವರ ಕಮಿಟ್ಮೆಂಟು, ಯಂಗರ್ ಏಜಲ್ಲಿ ಅವ್ರ ಕಮಿಟ್ಮೆಂಟು. ಅವ್ರ ಕನ್ಸಲ್ಟೆಂಟಾಗಿ ಇದೇ 2 ಗಂಟೆ ಒಂದು ನರ್ಸಿಂಗ್ ಹೋಮ್ಗೆ ಹೋದರೆ ಯು ಕ್ಯಾನ್ ಅರ್ನ್ ಮಚ್ ಮೋರ್. ಅವರು ನಮ್ಮ ಕಾಲೇಜಿಗೆ ಬಂದಿದ್ದಾರೆ. ಅವರಿಗೆ ಕಾಲೇಜಿನ ಪರವಾಗಿ ಮತ್ತು ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕವಾದ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಇದ್ದೀನಿ. ನಮ್ಮ ಜೊತೆ ಇವತ್ತು ಫಸ್ಟ್ ಟೈಮು ರಮೇಶ್ ಅವರು ಡಾಕ್ಟರ್ ರಮೇಶ್ ಆಗಿ ಸ್ಟೇಜ್ ಮೇಲೆ ಕೂತಿದ್ದಾರೆ. ಮೊನ್ನೆ ಅವ್ರಿಗೆ PhD ಅವಾರ್ಡ್ ಆಯಿತು. PhD ಅವಾರ್ಡ್ ಆದಮೇಲೆ ಮೊದಲನೇ ಪ್ರೋಗ್ರಾಮ್ ಇದು. ಡಾಕ್ಟರ್ ರಮೇಶ್ ಅವರಿಗೆ ನಿಮ್ಮೆಲ್ಲರ ಪರವಾಗಿ ಹೃತ್ಪೂರ್ವಕವಾದ ಸ್ವಾಗತ. ಮೇಡಮ್ ವಿಜಯಲಕ್ಷ್ಮಿ ಅವರಲ್ಲಿ ಬಂದಿದ್ದಾರೆ, ಸೀನಿಯರ್ ಫ್ಯಾಕಲ್ಟಿ ಫ್ರಮ್ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ ಆಫ್ ಬಾಟ್ನಿ. ಮೇಡಮ್ ವಿಜಯಲಕ್ಷ್ಮಿ ಮೇಡಮ್ಗೆ ಹೃತ್ಪೂರ್ವಕವಾದ ಸ್ವಾಗತವನ್ನು ಕೋರ್ತಾ ಕಾರ್ಯಕ್ರಮವನ್ನು ನಡೆಸ್ಕೊಡ್ಬೇಕು ಅಂತ Dr.HN ಅವ್ರನ್ನ ಕೇಳ್ಕೊತೀನಿ.
Good evening, everybody. My name is Dr. Arjun. I'm a practicing physician diabetologist at Dr. Mohan's Baswantudi. Sorry, Ellargo, I'm sure it's your time to leave. I'll not take much of your time, okay? Not more than half an hour for sure, okay? The reason I want to talk about lifestyle disorders per se, like Madam said, diabetes, hypertension, fatty liver, what we say, where cholesterol goes and deposits into the liver, is because of this. The present age, in the olden times, above the age of 60 was where diabetes was affecting. But if you see this slide here, my youngest patient, who's a type 2 diabetic, is an 18-year-old. So we are seeing patients from the age of 20 and goes on and on. And if you see these statistics over here, in the year 2019, in India itself, we had 77 million people, and the expected is 100 million in 2030 and close to 134 in 2045. What is just a disorder? Disorder andre diabetes, hypertension, in particular diabetes is not a disease. It can easily be managed by proper diet, proper exercise. You will have a perfect healthy life. So when I say proper diet and exercise, I am not going to stop all of you from eating anything. What I'm saying is eat healthy, exercise more, you will really be healthy, okay? So what you have to keep in mind is this. See, what causes diabetes? See, okay, how many of you read the newspapers over here? Yesterday there was an article. Have you heard about this guy, Zerodha co-founder, Mr. Kamath? How many people go to gym or exercise in India? How many people go to the gym in your age group? How many do it? Any idea? Okay, how many here go and exercise? Honestly, how many exercise? 1, 2, 3. I see only 3 hands. So in India per se, only 0.2 population, the entire Indian population go and exercise. So one of the reasons why diabetes, and the main reason, see, the genetic factors is there for all. The main reason why diabetes is called is lack of exercise. So what lack of exercise leads to? Obesity. And then of course you have stress, lesser sleep, okay? And once we don't exercise, we start developing blood pressures, fatty liver, cholesterol, and everything, okay? What are the types of diabetes? Anyone knows here how many types of diabetes? Okay, what is diabetes? Anyone knows what is diabetes? What exactly is diabetes? Have you heard about it? What will increase in diabetes? It is nothing but when the sugar levels, have you heard about glucose? All of you here. Glucose, but you have heard? So when the sugar levels goes above a particular range, that's when we define it as diabetes, okay? So what we see is we have 3 different types of diabetes where we say type 1. Type 1 is something which is very less in population, but yeah, it is unfortunate because it is classically seen in children. When I say children, starting from the age of 5 years, goes up to 15, and here the only treatment over here is insulin for 4 times. But what we have seen is not type 1. Type 2 is the most prevalent disease which is seen in the age group what I showed you, 20 to 79. And what is gestational diabetes? Gestational diabetes is classically something which comes in pregnancy, okay? So what happens is, generally women in the second trimester, like let's say 20 weeks in the 23, 24 weeks center, they develop diabetes. At the time of delivery, it goes off. But after delivery, after 6 weeks, none of them get a glucose test. And it comes back. And they eventually progress into type 2. So type 2 is something which is most common. More than 90% of India is what we see in type 2. So mainly that is what I'm here to talk about. Because type 1 generally has no cause. It is seen in the children. Unfortunately, we have not found a cause. But yes, with respect to treatment, there are a lot of advances with respect to treatment of type 1 diabetes. Okay? So these are all the symptoms of diabetes we see. But where we see where increase, people start urinating in the night, you have burning sensation in the feet, but out of 10 patients, there's only 1 or 2 who actually experience these symptoms, okay? So this is what I was saying. How do we diagnose? There's a test called as a 3-month average, which is called as the HbA1c. So that is how we diagnose this one. Complications, as you're all aware, it affects the nerves, it affects the kidney, it affects the heart. Most importantly, it affects the eye, and it also can lead to the foot cataract and everything. So this is where I want all of you to pay attention, okay? When it comes to diabetes management, like I said, diabetes is not a disease, it's just a disorder. And the next slide, this is not only for people who are diabetic, it's also for people to lead a healthy lifestyle to prevent diabetes, okay? So how do you do this is, You say, always, you start off your morning by this, you finish off your dinner also by this. So what do you think are the biggest source of proteins among vegetarian? What are the examples of proteins? Can you tell me? What are the examples of proteins? Excellent. Then apart from that, chicken, chickpeas, okay, then eggs, then how many of you consume all this? I see only 1, 2, 3. How often? How often? Andre, every day or once in a week or once in a month? How often? Every day. Okay. What are the examples of carbohydrates? Apart from rice? Potato, yes, excellent. Apart from potato? Pumpkin, okay. Apart from that? All, majority. The thing is, what are carbohydrates? It's not only a rice, idlis, dosas, uddin vadas, chapatis, then apart from our uppit, what we all like, karabat, aulaki, shavgebat. Unfortunately, the reason I wanted to tell this, we start off a day, not only here, whole of India, we feed only on carbohydrates. And carbohydrates is the main reason why we develop diabetes. And once we develop it, though, yes, we talked about reversal is possible, but let's prevent it first of all, because as you see, the age group is 20, so that's the reason why I wanted to tell you. So what you do is, start your day healthy. Instead of have the idlis, have the dosas, but keep it restricted to what? Once, twice, thrice. Instead of the shavgebats, the aulakis, and the uppits, and the pongals, and the bisibela bath, and please, not the rice bath in the morning, change to something, let's say, oats, have something like muslis, have something like eggs in the morning. This is actually enough. So oats probably with a couple of boiled eggs, or people who are vegetarians over here, sprouts, and a fruit. Maybe fruits, maybe papayas, maybe oranges, maybe lemons. You cannot get a better healthy breakfast than that. And of course, in the lunch, you're definitely allowed your 100 grams of rice. This basically, because at your age group, you definitely have to have the carbohydrates. Again, coming to dinner, how many of you, what do you have for dinner over here? It's again sambar rice, curd rice, rice bath. What's your normal dinner? Excellent, excellent. That's the best. Apart from Raji ball, one chew rice? There you are, see? So it's not that you should not have rice, okay? But the thing is, limit the quantity, because what we say is, we do not have to exceed more than 150 grams of carbohydrates in a day, because it all depends upon the body weight, okay? But generally, instead of 150, count the number of carbohydrates. Our breakfast is carbohydrates, our lunch is carbohydrate, and I'm pretty sure most of you over here will be having the puffs, the cakes, and the bhajis, and the bondas. You take everything. So mainly, probably the daily intake of carbohydrates will only almost be around 500 to 700 calories, which is quite high, okay? Limit it. Increase the proteins. Proteins, like someone said, you have paneer, you have soya, you have chickpeas, you have rajmas, you have dals, of course, you have chicken, fish, eggs. That is where you say, when I said healthy food, okay? So this is where I want all of you to pay attention to. And the next slide, okay? How many people like you have this Red Bull and the Sting and everything over here? You must have heard of it, right? Please stop that, okay? Because I have 3 people, all of them IT professionals, some of them call center employees who had liters and liters of Red Bull, who were non-diabetic 6 months back, only to stay awake at night. What do these drinks have? They called them, they said energy drinks, but the only type of energy they have is caffeine. So caffeine is the only one which makes us awake at night. So please do not have all that. Lime juice, coconut water, fruit juices sometimes, yes, and water, buttermilk, they are the healthiest. But our Pepsis, our Thumbs Ups, our Sprites, and this one, once in a while, but definitely not daily. And of course, no, the other types of the Red Bull and everything, definitely no. This is what I want all of you over here to concentrate on, and how much the first part, madam, yeah, this is what I was talking about also. The first part is here where a majority of them do. The aerobic exercise, that is walking. Aerobic exercise can be walking, running, jogging, swimming, cycling, everything. But that helps only the heart and the lungs. So majority I see here, the other young population over here, this is what I wanted to concentrate on. Resistance training, okay? That is strength training. Can either be in the form of mild gymming or can be in the form of yoga. Anyone here knows, how many of you have heard about Surya Namaskara? It's not that, what is Surya Namaskara? Exactly, yes. Can you guess how many calories one Surya Namaskara, if we do, how many we lose? You are right, I heard the right word. How much? It's around 25 to 30 calories by doing one Surya Namaskara. So one cycle is what? We do close to around 10, then we have different types of asanas. So by starting the day, by doing yoga, we lose anywhere between 400 to 500 calories. So the one small idli we eat at home, the homemade idli is 60 calories, okay? So once we, instead of do the exercise, then even if you, sometimes if you exceed with the carbohydrate also, it's no problem. Apart from the yoga, you also have strength training. That is in the form of the gym. When you guys go to the gym, please don't do the bodybuilding stuff because they're going to advise you 10 nets, 3 kg chicken, this one, no. Lift light weights, but do more repetitions, okay? So these two things I want, please start, all of you start, okay? Second thing is, this is for basically for people who are diabetic. Is diabetes is reversed? Yes, it is definitely possible. How do we reverse it? The main reason in Indian population why people do develop diabetes is because of the body weight. So please don't put on weight. So muscle weight is different. What fat we put on is different. Mainly the fat, what we deposit when we hit the abdominal area, that is really bad. That is what shouldn't happen, okay? Because once it deposits in the abdominal area, we start deposition of cholesterol in the liver and everything, okay? So this is how it can be reversed. And this is the latest advance with respect to diabetes management. This is what we say as CGM. What is a CGM? You must have all heard about a glucometer. All of you here have heard about a glucometer. What is a glucometer? Blood sugar. How do we check that? You keep pricking it, right? We keep pricking the fingers and check. So what is a CGM? A CGM is something where we put a small patch, a patch which is exactly like this. We put the patch over here. It is a painless procedure. And we give you a reader. So this is a reader where you're always checking the sugars. Okay, what does this do? It has been proven now that HbA1c is no more the cause of complications. Here, if you see in the figure for 90%, minimum of 70, maximum can be of 90. I want all the diabetics, or even for a normal population also, sugar should be between the 70 to the 180 range. Okay, so what does CGM do? It helps us keep the tracking of the sugars. There are definitely no prickings and the variations. And you yourself will understand, okay, today I've had a burger, how much my sugar is spiking. Today I've had rice, how much it is spiking. But today I've had something healthy, how much it is in range. And most importantly, exercise. So I've done so much exercise, so okay, it is in range. So probably I can have the extra dessert. So that's when you'll be able to keep in touch. So this is how the CGM is. This is the newest method with respect to management of sugars. This is what we, generally in a glucometer, this is what we miss. What I say, the unnoticed highs. The unnoticed highs is, let's say after lunch, you go to a function and come, someone ends up with 300, 350. Unless we check, we will not know. But having a patch on, you'll definitely know it. So this is how it comes. And the latest advancement, what I was saying with respect to type 1 diabetes, that is the insulin pump. This is the insulin pump over here. So this pump, the advantage of this pump, generally I told you, the people who are youngsters, children, let's say 5 to 7 years, 10 years, they have to prick themselves not only 4 times with insulin, they also have to make sure they check their sugars often. So the advantage of this pump here is, it's a new pump where the pump itself decides the dosage. We only teach the patients what is called the calorie counting, that is a carbohydrate counting. This is the latest advances with respect to type 1, okay? This is for all the youngsters and everyone over here. How many of you took the COVID vaccine over here? All of you have taken. How many of you have heard about the flu vaccine? No one has, okay, madam has heard about the flu vaccine, okay. How many of you have heard about the word called as virus? Okay. How many of you have heard about called as bacteria? Fine. So what is influenza? Influenza based, okay, what are the different types of viruses you know? Science students? Mixed, okay, fine. So what are the different types of viruses you know? DNA? Okay, have you heard about DNA and RNA? So we have 2 different types of viruses, okay? DNA virus and RNA virus, okay? So basically, influenza is something, mainly we have the group of RNA viruses. So there when we, okay, in simpler terms, we keep getting this cough, cold, fever, allergy, then some people develop asthma because of the pollution and everything. What is the most common cause of cold over here? You think cold is caused by a bacteria or you think cold is caused by a virus? How many of you say bacteria? How many of you say virus? Excellent, yes, it is the virus. So how many of us end up taking antibiotic for a cold? How many of you here? Let's say you get up tomorrow, next day morning, you have fever, you have, let's say, running nose, you have watery eyes, you go to a local physician or local anyone somewhere, they write you an azithromycin or doxycycline. Indirectly, by taking those antibiotics for a viral infection, which is not going to help, we are doing more harm for ourselves, okay? So what to do? What does this flu vaccine help? Basically, these vaccines they have the antibody. For example, all of you took COVID vaccine regarding what? What was your reason behind taking the COVID vaccine? Any idea, any explanation here? Why did anyone take the COVID vaccine? What will happen? Once we take the vaccine, what happens in the body? Pardon me? Yeah, antibodies are produced. Immunity is produced. Exactly. So what is the flu vaccine? It is the same. It covers close to lot of all the latest one is the H2N2, the H3N3, the latest mutation viruses. Okay, because viruses mutate very often. Okay, so once we take the vaccine, within 6 weeks we have antibodies produced. Okay, so the incidence of cough, cold, fever, everything reduces. Asthma people are prone to a lot of other things. That also reduces. Allergic symptoms comes down. Indirectly, we are raising the immunity. It's mainly taken for people about the 6 months, taken only once a year. The second, pneumococcal, this probably is not required for the year. It's mainly taken for people who are 60 for more. In particular, if you know someone who are smokers, yes. For such people, that is where we take the pneumococcal vaccine, which is taken once in 5 years. But yes, flu vaccine is something which really improves the immunity. It is taken once a year, and it most importantly, it will prevent you from taking antibiotics indirectly, improve your immunity, decreasing antibiotic resistance. Okay? That's it from my side. I just wanted to concentrate on this side and the diet. I hope all of you have understood what the diet is. Any doubts from here? All clear? Right? Yeah, thank you so much. Thank you. Half the people who have worked 6.2, 6.3, we have stopped. They have left the normal diet, gone into genie. It goes up to 9.4, 9.5. Because I don't mind millets, but I'm not justifying unpolished millets. This is okay. But millets, most often they're not as polished. So anything which is polished, let's say for example, even chapati I said has starch, even ragi has starch. So always remember, nothing should be taken in semi-solid or liquid form. So I've heard ragi ganji, ragi amli. The minute we take it in semi-solid liquid, it hits the blood straight. So we have spikes. So no salt, semi-solid or liquid. It's either ragi roti, ragi dosa, which is a good healthy breakfast. And the churnet and exactly. And add lot of proteins, dals, etc. That is the best. So ideally, we start off a day with vegetables and proteins, because to explain it further, there is something called as insulin resistance. Early morning, we all have to work. All of them have to come to college. We all have to work. The anti-insulin hormones, in particular, let's say the epinephrine, noradrenaline, more importantly, the glucagon, they are high. So if I have a vegetable, if I have a diet which is filled up with carbs, they are all anti-insulin. We are not going to let the insulin work. So after break, in India, that's the problem. Half the post-meal sugars are always 250, 270. But you see the fasting sugars will be 90, 100 because of this one. So how do we avoid this? Only by changing the breakfast. And if we are able to control the post-breakfast sugars, the whole day will be increased. So this insulin resistance in the morning and the night, why I say no carbs, because we take it and go off to sleep. So there is no digestion. So this is the reason why. So if you avoid carbs at night, the fasting comes normal. And have a diet with vegetables and proteins in the morning with the fruit, of course. You will have whole day will be absolutely normal. And exercise, walking alone is not enough. We have to do strength. Vegetables, boiled or raw? Anything is fine, madam, apart from potato and beetroot. Potato, because of its starch. Beetroot has a high glycemic index. Beetroot. It has a high glycemic index. Glycemic index is something which we measure in all fruits, all vegetables. So how quickly our blood sugar rises?
And some diabetors, they are suggesting eat banana. At that off, right side off, you can eat any number of banana, you will sugar will come down.
Today I was talking to that patient. She's on 2 times insulin, having banana every day.
To eat that curry leaf.
Curry, Ayurveda is fine, sir. Curry leaves, bitter gourd, astral, neem, those things are fine.
Ultimately, some of them are suggesting not to eat that bitter gourd.
No.
It is affecting the kidney also. So we don't know whom to.
With respect to a doubt, bitter doubt, bottle doubt, sourdough, astral, there's a small excipient in the vegetable which can harm our liver. So what we tell them, not more than 30 ml, take it raw, not more than 30 ml, not more than twice or thrice a week. Because fasting sugars depends upon the liver. And postprandial depends upon the amount of insulin and how much we exercise. So you can take that. But definitely no banana. One banana is around 150 calories. So definitely no banana.
Sir, ಇಲ್ಲಿ ಇದು ಪ್ಲಸ್ ಬಾಕ್ಲಲ್ಲಿ ಡೈಕಾನ್ ಹಾಸ್ಪಿಟ್ಲು, ಡಾಕ್ಟರ್ ಅರವಿಂದ್, ಅದೇ ನಮ್ಮ ಯಾರು ಫಿಲಮ್ ಆ್ಯಕ್ಟ್ರ್ ಶ್ರೀನಾಥ್ ಅವ್ರ ಬ್ರದರೇ ಅವರು ನಾನೀಗ 22 ವರ್ಷದಿಂದ ನೋಡ್ತಾ ಇದ್ದೀನಿ. ಅವರು ಸೇಮ್ ಎಲ್ಲ ವಿಡಿಯೋ ನಿಮಗೆ ಎಲ್ಲ ಇದ್ದಿದ್ದು ಫುಡ್ಡು ನ್ಯೂಟ್ರಿಷನ್ ಎಲ್ಲ ಎಕ್ಸ್ಪ್ಲೈನ್ ಮಾಡಿ 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 ಸರ್. ಐ ಹ್ಯಾವ್ ವಿಸಿಟೆಡ್ ಸೋ ಮೆನಿ ಟೈಮ್ಸ್. ಐ ಟುಕ್ ದಿ ಅದರ್ ಪೀಪಲ್ ಆಲ್ಸೋ. ಬಟ್ ವಾಟ್ ಎವರ್ ದೇ ಸೇ ಇಸ್ ನಾಟ್ ಲೈಕ್, ಇಟ್ ಇಸ್ ಟ್ರೂ ಆಲ್ಸೋ. ಬಟ್ ಯಾರಿಗೂ ಡಯಾಬಿಟಿಕ್ ಬರದೆ ಯಾರಿಗೂ ಅವಾಯ್ಡ್ ಆಗ್ತಾ ಇಲ್ಲ. ಬಟ್ ಡೇ ಬೈ ಡೇ ಡಯಾಬಿಟಿಕ್ ಜಾಸ್ತಿನೂ ಆಗ್ತಾ ಇದೆ. ಆಮೇಲೆ ದಟ್ ಕಂಟ್ರೋಲ್ ಸಿಸ್ಟಮ್ಮು ಅದನ್ನ ಸಜೆಷನ್ ಮಾಡೋರಂತೂ ನಂಬರ್ ಆಫ್ ಪೀಪಲ್ ಆರ್ ಇನ್ಕ್ರೀಸಿಂಗ್ ಲೈಕ್ ಎನಿಥಿಂಗ್. ಆ್ಯಂಡ್ ನೀವು ಡೈಲಿ ಟಿ ವಿಯಲ್ಲಿ ಪೇಪರಲ್ಲಿ ನೋಡ್ತಾ ಇದ್ರೆ ಈಗ ಡಯಾಬಿಟಿಕ್ದೇ ಮೇಜರ್ ಇಶ್ಯೂ ಆಗ್ತಾ ಇದೆ ಅಲ್ಲಿ. ನೀವು ಯಾವುದೇ ಶೋಗೆ ಹೋಗಲಿ ಇನ್ನೊಂದಕ್ಕೆ ಹೋಗಲಿ ಎಲ್ಲ ಕಡೆನೂ ಹೌ ಟು ಕಂಟ್ರೋಲ್ ಡಯಾಬಿಟಿಕ್. ನಿಮ್ಗೆ ಡಯಾಬಿಟಿಕ್ ಈಗ ನೀವು ಯಾವುದೇ ಹೋಟ್ಲಿಗೆ ಹೋದರೆ ಡಯಾಬಿಟಿಕ್ ಅವ್ರನ್ನೇ ಫಸ್ಟ್ ಟಾರ್ಗೆಟ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ. ನಿಮ್ಗೆ ಶುಗರ್ ಇದೆಯಾ, ಶುಗರ್ ಇಲ್ವಾ, ಯಾವ್ದು ಬೇಕು ಅದು ಇದು ಅಂತ ಈ ಥರ ಆಗಿದ್ದಾಗ, ಸೊ ಆಸ್ ಎ ಸ್ಟೂಡೆಂಟ್ ಆ್ಯಂಡ್ ಆಸ್ ಎ ನಾನ್ ಡಯಾಬಿಟಿಕ್ ಹೌ ಟು ಕಂಟ್ರೋಲ್ ಆ್ಯಂಡ್ ಹೌ ಟು ಮೇಡಮ್ ಹೇಳ್ತಾ ಇದ್ರು ಅಗ್ರಿಕಲ್ಚರ್ 70-80 ಮಾಡ್ತಾ ಇದ್ದವ್ರಿಗೆ ಶುಗರ್ ಖಂಡಿತ ಇಲ್ಲ ಮೇಡಮ್. ಈಗ ಪಾಪ ಹಳ್ಳಿಯವ್ರಿಗೆ ಹೋಗಿ ಹಗಲು ರಾತ್ರಿ ದುಡಿತಾ ಇದ್ದಾರೆ, ಶುಗರ್ ಬಂದಿದೆ. ಶುಗರ್ ಬಂದಿದೆ. ನಾನು ಬೇಕಾದರೆ ಈಗ ಲೈವ್ ಎಕ್ಸಾಂಪಲ್ ಕೊಡ್ತೀನಿ. ಹಗಲೂರು ಬೆಳಗ್ಗೆ ಎದ್ದು ಸಾಯಂಕಾಲ ತನಕ ಅಲ್ಲಿ ಇರಲಿ, ಬೇರೆ ಅದು ಮೆಂಟಲ್ ಸ್ಟ್ರೆಸ್ಸಿಂದ, ಫುಡ್ ಹ್ಯಾಬಿಟಿಂದ, ಎಕ್ಸಸೈಸು ಈ ಥರ ಆಗಿದೆ. ಅಲ್ಲ, ನಾನು ಡಿಸ್ಕಷನ್ಗೆ ಬರ್ತಾ ಇದ್ದೀನಿ. ಅಫ್ಕೋರ್ಸ್ ಯೋರ್ ಸರ್ ಇಲ್ಲ, ಈಗ ನಮ್ಮ ಅದೂ ಚೇಂಜ್ ಆಗಿ ಅದಕ್ಕೆ ಫುಡ್ ಶಿಫ್ಟೆಡ್ ಟು ರೈಸ್ಗೆ ಹೋಗಿದ್ದಾರೆ. ಆಮೇಲೆ ದಟ್ ಏನು ಆ ಕ್ವಾಲಿಟಿ ಆ್ಯಂಡ್ ಬ್ರೀಡ್ ಆಫ್ ದಿ ರೈಸ್ ಈಸ್ ಆಲ್ಸೋ ವೇರಿಡ್. ಆವಾಗ ನ್ಯಾಚುರಲ್ ಲೋಕಲ್ ಬ್ರೀಡ್ ತಿಂತಾಯಿದ್ರು. ಈಗೆಲ್ಲ ಪಾಲಿಶ್ಡ್ ಒನ್ನು ಗೋಲ್ಡನ್ ರೈಸ್ ಎಲ್ಲ ಬಂದು ಹಾಳಾಗೋಯ್ತಲ್ಲ ಅದು. ಯಾ ಸೊ ಹುಡುಗರು ಏನಾದರೂ ಡೌಟ್ಸ್ ಇದ್ದರೆ ಕೇಳ್ಬೋದು. ಏನಿಲ್ಲ, ಇರುತ್ತೆ, ಕೇಳಲ್ಲ ಅಷ್ಟೇ. ಅಲ್ಲ, ಡಯಾಬಿಟಿಕ್ ಮನೆಯಲ್ಲಿರ್ತಾರೆ, ಅವ್ರ ಪರವಾಗಿ ನೀವು ಕೇಳ್ಬೋದು. ನಿಮ್ಗೆ ಡಯಾಬಿಟಿಕ್ ಇದೆ ಅಂತ ಕೇಳ್ತಾ ಇಲ್ಲ ನಾವು. ಯುವರ್ ಪೇರೆಂಟ್ಸು, ಗ್ರ್ಯಾಂಡ್ ಪೇರೆಂಟ್ಸ್ ಯಾರ ಇದ್ದರೆ ದೇ ಆರ್ ಫೇಸಿಂಗ್ ಸಮ್ ಕಾನ್ಸಿಕ್ವೆನ್ಸಸ್ಸು. ಯು ಕ್ಯಾನ್ ರೈಸ್ ದಿ ಕ್ವಶನ್ನು. ನಮ್ಮ ಅಪ್ಪಗೆ ಈ ಥರ ಇದೆ, ನಮ್ಮ ತಾತಾಗೆ ಹಿಂಗಿದೆ, ಅಜ್ಜಿಗೆ ಹಿಂಗಿದೆ, ಅವ್ರಿಗೆ ಕಂಟ್ರೋಲ್ ಹೌದಾ ಇದೆಯಾ? ಯಾರೂ ಇಲ್ಲದೇ ಇರೋರು ಇದ್ದಾರಾ? ಹಾಂ, ಮತ್ತೆ ಹಾಂ ನೋಡಿದ್ರಾ, ನಾನು ಕೇಳಿದಾಗ ಇದು ಹೇಳ್ತಾ ಇದ್ದಾರೆ. ಹೇಳಮ್ಮ ಪರವಾಗಿಲ್ಲ.
ಇತ್ತೀಚೆಗೆ ಜಾಸ್ತಿ ಶುಗರ್ ಅಂದರೆ ಜಾಸ್ತಿ ಆಗ್ತಿದೆ, ಮತ್ತು ಅವ್ರಿಗೆ ಯಾವಾಗಲೂ ಸುಸ್ತಾಗ್ತಾ ಇರುತ್ತೆ. ಒಂದು ಸ್ವಲ್ಪ ಕೆಲಸ ಮಾಡಿದ್ರೆ ಅವ್ರಿಗೆ ಜಾಸ್ತಿ ಸುಸ್ತಾಗುತ್ತೆ. ಅದಕ್ಕೆ he's being too stressed out, sir.
Stress plays a part, but it's a very small factor. I'm not saying stress is a big factor, but it does play a part, but it's not going to play a major part. The major part is the two things what I told you.
Even his mother is having the diabetes, so like.
For all. Actually, all the Indians, because of this one, our body constitution, everything, we are prone. But had it been a genetic factor, reversal as of today would have never been possible. The very fact it is plausible, it is just a disorder. Lack of exercise, too much of weight gain, we don't know what we are eating. These three things, if we do.
He's not gaining the weight, he's losing the weight.
High sugar causes muscle loss, it is not weight loss. High sugar causes muscle loss. Muscle loss is unhealthy. Muscle loss is very unhealthy. We need fat loss, we do not require muscle loss. So one of the symptoms is high sugar is muscle loss, burning sensation in the feet, especially at night, increased urination, then you have pain in the calf.
Everything is
All
happening.
that is not high sugar.
ಸರ್, ಇಲ್ಲಿ ಕಾಲು ಮೀನಿನ ಖಂಡದ ಹತ್ರ ತುಂಬ ಉರಿ ಅಂತ ಹೇಳ್ತಾರೆ.
ಇದ್ದೀರಾ? ಸೊ ಅವ್ರ ಪರವಾಗಿ ಏನಾದ್ರು ಅದೇ ಅಂತೀರಾ? ಓಕೆ. ಹಾಂ, ಎಲ್ಲರಿಗೂ ಈಗ ಯಾರು ಬ್ಲಡ್ ಟೆಸ್ಟ್ ಮಾಡಿಸಿಲ್ವೋ ಪ್ಲೀಸ್ ಚೆಕ್ ಯುವರ್ ಬ್ಲಡ್ ಲೆವೆಲ್. ಫ್ರೀ ಆಫ್ ಕಾಸ್ಟ್. ಟೇಕ್ ಅದೇನೋ ಜ್ಯೂಸ್ ಕೊಡ್ತಾರೆ, ಅದು ಶುಗರ್ ಫ್ರೀ ಅಂತೆ. ಬಿಸ್ಕೆಟ್ ತಗೊಳ್ಳಿ, ಅದು ಶುಗರ್ ಫ್ರೀ. ಪಾಪ ಇದು ವಾಲಂಟ್ರಿಯಾಗಿ ಬಂದು ಚೆಕ್ ಮಾಡಿ ಈ ಥರ ಮಾಡ್ತಾರೆ. ಇಟ್ ಈಸ್ ಅವರ್ ಪ್ರಿವಿಲೇಜ್. ಸರ್, ಆನ್ ಬಿಹಾಫ್ ಆಫ್ ಅವರ್ ಕಾಲೇಜ್ ಆ್ಯಂಡ್ ಮ್ಯಾನೇಜ್ಮೆಂಟ್ ಆ್ಯಂಡ್ ಪ್ರಿನ್ಸಿಪಲ್ ಮೈಸೆಲ್ಫ್, we extend our sincere thanks for coming and giving this information for our students. Arjun, okay. So we are going to visit your clinic center. Thank you very much, sir.